My name is Dr. Eleanor Nakintu. I'm the clinical director for the Babies and Mothers Alive program. We are in our second year of implementation in both Rakai and Chotera districts, which initially was Rakai district. We have been focusing much on the midwife, the health provider, the midwife at the facility, in the maternity ward, and then the in charge of the facility. So we have done several trainings and mentorships, in particular focusing on her ability to handle an obstetric emergency, a newborn emergency, her ability to have the competence, the skills, the proper skills that we need to handle an emergency when it arrives, and especially for the medical officers, the preparedness to make sure that their facility is ready to handle an emergency when it comes in. So that means they should also be able to know whether they have blood in the laboratory. So if they do not have blood, they should be able to assess the risk of the mother. If she needs blood, then they have to refer her on time. Not only that, but also the general leadership of the facilities, right away from the administration, whether we have the right amount of drugs that we need for the mothers at the right time so that we can be able to make orders on time. Then at the community level, we have ambassadors, we've trained ambassadors. What we focus on is their ability to follow up the mothers. When they see a pregnant woman, they should be able to register her, follow her up until the time of delivery, and also encourage her to go for antenatal checks. There's still a challenge. Sometimes, like we saw, some of the distances are very far, and as she keeps walking to the health facility, as she gets closer to the time of delivery, she gets more tired. So that's why we still have a challenge with antenatal care. Antenatal care number 4. Very few of them can be able to come. However, when the time for delivery comes, they always arrange. So we talk to the ambassadors to be able to talk to these mothers. Are they saving enough? Or are the male, their spouses, are they involved to help them save for the transport? Do they have someone who is going to be attending to her? Do they know where they're going to deliver from? So they go and educate them so that when the time comes, they are ready. So there's readiness at the community level and also at the facility level. Then also with the district leadership, some of them are not health workers. So we always want, yes, there's a lot of HIV, but we always want them to focus on the mother in the communities. So we pivot their minds a bit to think about maternal death, perinatal death, so that when they go out, they are doing a lot of advocacy. They encourage these mothers to come to the facility, deliver from the facility, proper hygiene, and also to save the lives of their newborn babies. So we still have several challenges left. So the roads, the transport, sometimes the roads are very far, the mothers haven't been able to save, and also the ability of the woman, this poor woman, to be empowered, that she has to take care of her life at the time when the time for delivery comes. She has to know that she owns her life, the baby belongs to her. So we kind of empower them. We have so many issues with the male involvement. Sometimes the males do not want them to go to the facility. But not only that, we still have a challenge in convincing them to have family planning. That is something that we are going to plan for in the next phase of our implementation. So we want to advocate for family planning, cervical cancer screening, telling them to come to the facilities. And together with the Ministry of Health, we are working to reduce maternal mortality and morbidity and newborn deaths and morbidity in Rakai and Chotera districts.